Hello, viewers. So once again, we are back on. Over the last few weeks, we have been looking at domestic abuse. And then last week, we looked at domestic abuse and mental health. Last week, we were looking at the correlation between domestic abuse and mental health. So for this evening, for this session, we are solely going to concentrate on mental health, mental illness, and support services available. Last week, people had keen interest in what we were talking about, and people wanted to get more information around the area of mental health. So it is the view that today we would have a package, where we are solely going to concentrate on mental health, so that people would have a good understanding of what mental health is all about, what mental illness is all about, what mental disorders are all about. Before we go any further, I would ask my honorable panel members here to introduce themselves. So I would first of all start with Dr. Ajile, please.
Thank you. Good evening, viewers. My name is Dr. Olaiwola Ajile. I'm a consultant psychiatrist and forensic physician based in the United Kingdom. I have been in practice for 25 years now, but I've specialized in psychiatry in the last 17 years. Thank you.
And then I'll move on to William, please.
Good evening, everyone. I hope you're all well. It's great to be back again with these wonderful people. Yes, I'm William Ejapon. I'm a social worker by trade since 2006. I'm also an approved mental health professional within the jurisdictions of the Mental Health Act 1983, which was amended in 2007. So yes, I'm approved since 2009, working in mental health and in social work. I'm currently a team manager for Birmingham City Council in the role of deprivation of liberty safeguards. So that's a little bit about me. Thank you. Elsie, back to you.
Wow. Fantastic. Thank you for that, William. And then we would move on to Madam Veronica.
Hi, everybody. Good to be on the show. And for our listeners, I believe you have a wonderful time with us. I am Veronica Tando, and I've been a mental health nurse, especially in forensic services.
Okay. Yes, we can hear you now. We are here to have lost Madam Veronica a bit. So we would move on to Dr. Joanna Larry Afutu.
Good evening, listeners.
We can't hear you.
I'm Dr. Joanna Larry Afutu. Good evening, listeners. I'm Dr. Joanna Larry Afutu. I'm a licensed clinical psychologist in Ghana. I've been practicing for about 15 years now. And my research area, I'm also a lecturer, by the way. My research area is on military psychology. And currently I've been doing a lot of psychosocial support for COVID, for other companies as well. Thank you very much. Hope we have a good time today. Thank you.
Wow. Thank you, everyone. Madam Veronica.
Welcome.
Okay, so your network went off a bit. So could you introduce yourself again, please? It's still off.
Can't hear.
All right, so we'll come back to Madam Veronica. Okay. Yeah, so we are fortunate to have, really great experts over here, people who are experts in, in this area. And, we've got a range of professionals. We've got, with varied, expertise. So we are really privileged here to learn, to be educated, to have an awareness and to feel empowered. So yes, this evening we are looking at mental health, mental illness, mental disorders. And without much ado, I would be going over to William. William, could you give us an idea in terms of what we're going to look at this evening? Yes, in terms of what package is in store for us for this evening.
Excellent, thank you. But before we go ahead, I think Madam Tando missed the opportunity to introduce herself. So if Veronica, are you able to hear me? Oh, the line isn't great. So I wanted you to introduce yourself to the viewers and listeners. Okay. All right, okay. So I'll go ahead whilst she's sorting out her technical issues. Now, last week we discussed a little bit about mental health, and after that it gained so much interest, and it was so encouraging to see how people got interested in this subject. It's encouraging to see the participation, the discussions that people got involved.
Yes, William.
Hello, I'm just checking whether you guys can hear me now.
Yeah,
right,
we can
okay.
hear you.
You can hear
now.
me.
Yes.
All right, thank you.
Yeah.
Right, okay.
Yeah, we can hear you now. So do you want to quickly, Madam Veronica, do you want to quickly introduce yourself and then we'll move on to William?
Okay.
Oh dear. Right, okay. It looks like I have to carry on.
Yeah, William, sorry, you have to carry on. Yeah.
Right, okay. Yes, so yeah, taking on from last week, we did talk a bit about mental health. And as I said, it gained so much interest. People were ringing me after the show. People were sending me direct messages. So it is an area that people are so keen about. They want to know more about it. They want to see what is actually the meaning of mental health and its impact on people. So taking on from that, we decided to, out of people's own requests, decided to look at one particular area, which is psychosis. Now, mental health is that broad. I mean, the manual alone that we use in the UK, the width of the book is like that, is that huge. So the content is varied and is wide and is such a vast area. It's a whole minefield. So we're just going to touch on psychosis. And after that, if people want to contribute, if people want to raise any particular areas that they want us to comment on, absolutely, they should feel welcome to do that. And it's a two-way thing. So we're going to concentrate mainly on psychosis. So without further ado, I think I will ask our good friend, Dr. Agyileye, to take us into more of what psychosis is all about. I mean, I had people ringing me to say, well, they have a family member who was seeing things that were not real, things like cockroaches. They had seen termites, and when they looked around, they couldn't actually see any termites. I mean, one particular person in their family was seeing all these things. The person was hearing voices. The person felt at some point like they were a god, more or less. They had these delusions and all sorts of symptoms which appear to be psychosis. So I would ask Dr. Agyileye to, from doctor's perspective, let us know all psychosis is about.
Okay, thank you very much. I think it's an important topic to discuss, and it's very relevant to, majority of our audience, particularly in the context of, our own viewers today. Psychosis is a major mental health illness, and it is a symptom of the mind as well. It's a symptom of major and serious mental illness. It is not a medical condition, it is a mental health problem. And it is one that is experienced by a lot of people when they begin to lose touch with reality. So by way of definition, psychosis is a mental experience characterized by loss of touch with reality. When people begin to have abnormal perception that is not shared by people around them, then it is a psychosis. Now, psychosis is a major, broad sort of topic, and the different kind of mental health disorder that are manifested in the form of psychosis. Now, a lot of people make a mistake of saying that, oh, you are psychotic, and they feel that's a diagnosis. That itself is not a diagnosis. It's just a symptom. It's a symptom of a diseased mind, and they are characterized by specific symptoms like delusion that you mentioned. And delusion is when someone has a fixed idea that is not in touch with reality. A fixed idea in which people are convinced that something is happening around them, but that particular idea is not evidenced by anything going on around them. I will give specific examples of delusion and later on. Also, psychosis is also characterized by when people have hallucinations in different modalities. And by means of hallucination, I'm talking of when people have abnormal perceptions, when they begin to perceive, sensations that are not there. There are no external stimulus, but they can feel something happening to them. And that can happen in different modalities, such as people hearing voices when there's no noise, when there are nobody talking to them, people seeing things, around them or in their environment, and whereas other people around them cannot see it. People can feel things crawling on their body, on their skin, whereas there's really nothing that they can see. So in the absence of external stimuli, people can have some abnormal perceptions, and that is what hallucination is all about. People can smell things when there's actually no reason to smell. There's no rubber burning, and people can feel there's a rubber burning. There's nothing burning around them, but they can smell that something is not right. They can so they can smell something, and the whole house is sort of poisoned, and that itself can cause a lot of distress for people. And also people can have a sensation whereby they feel their body or their internal organs have been taken away, which can be a very distressing symptoms of visceral hallucination. So hallucination relates with sensation, our sensory organs, the hearing, the visual, the smelling, the taste. So people can perceive a certain abnormal taste in their mouth when actually there's really nothing in their mouth. So it can occur in different modalities. Other types of psychotic symptoms are disorganization of thoughts, abnormal thinking. People can experience serious disorganization in their thoughts, and that can manifest in what they communicate, what they say, disorganized speech. So, for example, people can, experience what we call derailment when you ask them a particular question, but they just give you a different answer. It's so obvious that what they're answering is not correlating with the question you're asking them. They completely derail. Or people can obviously get so muddled together in their speech such that it becomes incoherent. You can't make a sense of what they're saying. And that is referred to as word salad. Okay, and people can also have other types of, thought abnormality, such as pressure of speech sometimes, losing of association, what they're saying does not connect with each other. They may make sense to some degree, but there's no connection between their train of thought. So they have complete, loosening of association. And that's the kind of, disorganized mind and thinking process. And that can only be manifested in the way they speak out. What they say does not just add on. And we will see a lot of people like that. They're just talking about different themes, but they're not just connected together and they make no essence whatsoever. Other types of, psychotic symptoms are things that, like, when people experience thoughts in a very, very strange way. Everybody's thought is private to them. What you are thinking in your mind and what I'm thinking in my mind is private to me. You are not supposed to know unless I say it out to you. But people experience abnormal situations or abnormal mental experiences whereby they believe that their thoughts is being broadcasted, to other people. Everybody, can hear what they think in their mind. So they feel they lost their privacy. And people like that obviously shut themselves out from people, okay? And people can have a situation whereby they feel their thought is being echoed loud to people as well. Everybody can hear what they are thinking. This is quite unusual. I mean, as I said, thoughts are private things. So when you now think that there is something that is sort of, expanding your thought and everybody can hear what you're saying, echoing it out. The moment you think about it, whether good thoughts or bad thoughts, everybody can hear it, then you lose privacy of your thoughts. And people can have a feeling, which can be intense sometimes, that also their thoughts, is being stolen from their mind. It's been taken out of their mind. So they have what we call thought withdrawal. They have a particular thought, they want to keep it, but suddenly they can't find it anymore. And their perception of that is that thought is being withdrawn from their mind. And also, in some cases, they might even feel that, abnormal thoughts or some thoughts or strange thoughts are being inserted into their mind. So they can have thought insertion and they can feel like, whatever they did wasn't, their fault. Somebody put that thought in their mind. So and it can be very intrusive in some situation, and that can be a very distressing experience for a lot of people. And in some cases, particularly for people who have been experiencing chronic mental health disorder of a type I'm going to discuss later on, they can feel like they lost their train of thought. They're just thinking and they want to communicate something to you. All of a sudden, the train just stopped like that. So they experience what we call thought block. So these are all clusters of formal thought disorder. And these are the kind of abnormal thinking process that people can experience. Now, going further, it can even be as complex as people having, passivity experiences, as we call it. And that means that they feel that they don't have control of every part of their body.
That's right.
It's sometimes referred to as made impulses, made, volition. People do things and they feel that something else was controlling them. There is an external force that's controlling them to do things, either positive or negative things. They feel they've lost control of their own, use of their own body, use of their own, time of their own mind. So they have experienced made volition, made impulses, and made activity. It is called passivity. It's passivity in the sense that it is alien to them.
Yes.
Okay, it's alien to them, and they feel their body and their mind is being controlled by other things. Now, those are all clusters of psychotic symptoms. Now, it can also, be experienced in the form of disorganization of personality. Somebody can just be completely irresponsible, and they just lose their personality, and they might withdraw from society, or they might withdraw from their family, and then
have we lost
psychosis by way of feeling like they can't sleep. They can be restless. They can be, very, very, agitated, and they get very extremely anxious. Now, those are, on a nutshell, what psychosis is all about. But for the major mental health disorder, one of which we're going to be talking about today, I think we're going to be, sort of streamlining down to the areas of delusion. Now, the delusion as a symptom of psychosis is a very, very, very serious, type of mental illness. And delusion, as I defined earlier, is when people have a extreme conviction, against the contrary, that something is happening to them. And they can experience it in form of paranoia. They just have this conviction and belief that people are conspiring against them. They're planning, to harm them. So they feel unsafe around people. And some people, because of that perception, they can get dangerous, because if they think that you around them, is planning evil, you're going to kill them, therefore they need to sort of protect themselves, they can act and harm you and cause serious damage. So people can experience paranoid delusion in that sense, or persecutory delusion, when they just believe the entire people, maybe their colleagues at work, or maybe people on the bus they are traveling on, are having a conspiratorial discussion, with a view, to do harm to them. And they're convinced that this is happening. The experience is very vivid and very real to them. And also people can have, delusion of references, whereby they sit and they're watching TV, suddenly, they believe that the TV is talking about them, or the messages that is being discussed on the radio is with reference to them. And they get very agitated about it. They get very upset about it. It's talking about me. Maybe the prime minister or the president is making a speech, general speech, and they personalize it. So they refer that, it takes a special meaning to them, and they get very upset about it, get very uptight about it. So people can experience delusion like that. Now, delusion also can be expressed in terms of grandiosity. When people feel that they have extra power, they have extra, they are rich than what they belong to royalty. They have some power to cure some certain conditions, and they have expansive, sort of mood, feeling like, they can do anything. And it can manifest to the point whereby people can just drive a car. When they feel they can drive a car without, even using the steering, they can jump off the bridge, without anything happening to them. And people have been known to do that. And then which will end up causing them serious damage. And now, other types of delusion will be delusion of jealousy, delusion of poverty. People believe, in the midst of plenty, people believe they don't have anything. Now, delusion of jealousy, whereby they believe that somebody else is about to take their husband, somebody else is about to take their wife, or they begin to have, jealousy ideas towards people, and they're convinced that somebody is actually taking their spouses away from them. And people can have erotomanic delusion. Erotomanic delusion is a delusion whereby people think, somebody of importance, somebody in the public space has fallen in love with them. And it's not uncommon for people to begin to stalk people like that. For when you suddenly think the wife of the president, has fallen in love with you, or one of the big, Nollywood or Gollywood, star, has fallen in love, and you're convinced that that is happening. And everything around you points to the fact that, yes, this person actually he sent me a message, or she sent me a message, she's in love. And then people begin to stalk people like that. And they can go to extreme lengths to sort of establish that, yes, this is true. I can tell you that this person is actually in love with me. It's called erotomanic delusion. Okay. And people can also have what we call shared delusion. Delusion, folly ado, whereby people can transfer, their own delusional thinking, their own delusional mind, and transfer to another person in the same household. So they sort of will cause a situation whereby their children or their family member begin to share that delusional belief with them, and then they become psychotic together. It is called family madness, or family delusion, madness of severality, they call it. So whereby people have shared delusion. So in the context of delusion, patient can present with various forms, but the commonest form we see in practice delusion, paranoid delusions, persecutory delusions, Delusion of reference is grandiose delusion, and they are quite specific with some specific conditions. Now, a nihilistic delusion can happen whereby people feel their internal organs are rotting, you know, their brain is melted, and things like that can happen to them. Now, when you move to hallucination, I need to break it down a little bit for the understanding of our viewers. Okay, as I said earlier, hallucination is abnormal perception, okay, of in the absence of external stimulus. Now, the one that is commonly associated with psychotic symptoms or psychotic disorders are auditory hallucinations. You know, when people, you know, begin to hear voices of people that are not there. And that can exist in different forms. People can experience it by way of them hearing that people are talking to them when there's nobody there. Okay? They can hear people talking to them, and when you look around, there's nobody. That is called, you know, second degree hallucination, second person hallucination. People can experience auditory hallucination, hearing people actually having something like a three-way conversation about them. For example, you know, saying, you know, talking about, for me and Sister Veronica talking about William, you know, and you can hear that these people are having conversation about me. You know, everything they're saying and discussing is about me. That is a third degree kind of, you know, hallucination. And people can also have running commentary, whereby, you know, they can see, and that can be quite distressing for some patients, and we see that a lot in Africa, whereby they feel and believe that whatever they do, whatever activities they are doing or about to do, people are running commentary about it. Imagine a situation whereby, you know, all you hear is that, oh, he's going to take a cup now, he's going to pick his phone and he's calling, and then he made this call, and then he, you know, he's talking about what he's going to eat, what's going to wear, and you can see how people running comment about what you do. No, he's tying his shoelace now. You know, what are you going to do now? He's going to take his ball. I mean, it can be quite distressing. And you look around, there's nobody. And who is talking about? Who is that person? And that is why you see people shouting, you know, you know, in the public. Leave me alone. Leave me alone. And you wonder, who are they talking to? Because that content, you know, is quite distressing for them. And therefore, they are responding to it. So it's not common for you to see people, you know, talking and moving around and talking, you know, in the public, and you wonder, who are they talking to? That is auditory hallucination. That is them experiencing distractive, you know, behavior towards the hallucination, you know, which is there. And visual hallucination is not quite common with psychotic disorder, but it can exist in it. And visual hallucinations are commonly, you know, when people see, you know, insects and termites, you know, running around, or they can see small little things around the house. One day I went to see a patient in our house. All she can see are all insects coming from the light switches. And when I got to this patient's house, she's already, you know, put her hands in the electricity socket. You know, risking her life. She was trying to block everywhere. She's, you know, sort of painted the whole room. You know, all the electric socket has been tampered with, because she believed that these things were coming out from there, and they were distressing to her. She couldn't even sleep on her sofa. She can see all of them crawling up and down, hands and everything. Seeing images on the wall. Some images are good images. One is devil images. It can be as vivid as that. And these are the flavor of psychotic symptoms. And now, the psychotic disorder are characterized by all these, and they are symptoms of major mental health disorder like schizophrenia.
Absolutely.
Okay, now they are the symptoms of major mental health disorder like bipolar affective disorder. When people have hypomania and mania. People can also experience psychotic disorder in depression. People can experience psychotic disorder when they're withdrawing from alcohol or drug. People can experience psychotic disorder that I've described, you know, also when maybe, for example, they had just, you know, they've used cannabis, for example. They can experience that. People can experience it when also they are in extreme state of stress. You know, when people are in a state of stress, they can have abnormal thinking, abnormal perception. Although it may be short-lived, but they can experience it in that same quality. but the large amount of psychotic disorders that we deal with and we will see in our people in Africa or in the United Kingdom would be the schizophrenic, psychosis. You can see it in schizoaffective psychosis when people have a mixture of mood disorder and then, schizophrenia, or severe depression with psychosis. I think I will stop there because there's so many more I can talk about.
Wow. Seriously.
On those I think so far.
Seriously. Wow. Yeah. Thank you so much, Doctor. You know what? We are learning, and I've had we have seen some interesting comments, from people. Charles Aubry is saying that very educative indeed. Keep it up, please, and God bless you all. Linda is saying that this needs to be beamed live in our communities. These are people in the churches branded, which is very sad. We've got Tina Latifa Jones saying that very deep, bro. And then we've got Akilo, and who is saying that super interesting. So people are saying, and then we've got Kofi who is saying that concept clearly explains Dr. Shelley. So yeah, this is deep and interesting. This is certainly deep and interesting. And thank you so much. And I mean, as Doctor was talking, I it made me to think, in terms of genders. William, I'm just, trying to think, do we have, trying to figure this out. Would you say that we have more women than men, with this condition, or would you say that it doesn't really matter in terms of gender?
No. Hello,
William. Do you hear me?
I think Dr. Ajile was struggling to hear. Can you still hear Dr. Ajile? Can you all hear Dr. Linda?
Yeah, we can hear you, please.
Okay. Oh, good. Right. Okay. Now, before I start that, I just want to say that mental ill health can happen to anybody. Right? These are mental health issues, so it doesn't discriminate, as we said the other day.
Okay.
Now, the similarity or the commonality between mental health, one of the commonalities between mental health and domestic abuse, as we talked last time, was that the two don't discriminate. It can happen to upper class, it can happen to the queen, it can happen to the lower class, it can happen to the working class, it can happen to any race, it can happen to any gender. So it doesn't discriminate at all, Elsie. Now, I think the message we want to put out there is that we don't want people to be scared of these symptoms. We don't want people to be afraid of these symptoms. What we want people to hear is to be knowledgeable and to have awareness about these conditions. So if these conditions are happening, then all of a sudden it gives them the idea that, actually, this could be linked with a mental health condition. That's the whole idea, is to create awareness, people to be aware of these things. They can support themselves and support others. So if they recognize and see these symptoms in other people, then they support them. So that's the whole concept of this discussion.
Wow.
Yes. The other thing I also want to say is that, the other thing I want to also say is that now, mental health, sometimes people associate it with violence. That, okay, this person hearing voices, this person is seeing things, and they are holding knives, they are holding guns, they are holding this. No, I want to actually break that myth. It's not every person who has mental health issues cause violence or perpetrates bad things. No, it's not everybody who does that. So it's just for people to be clear about that. Okay, so coming back to your question there, Elsie, it can happen to anybody. But what we tend to see is that in most cases, when people are faced with trauma, and that's where it all starts. People sometimes get abused, people sometimes face stress and begin to present these symptoms. And these symptoms are what the doctor has described it in a more elaborate way, which is great. So people are seeing these symptoms, but the symptoms are not actual, they're not actual mental health diagnosis. These are symptoms, okay? They are linked to diagnosis, such as schizophrenia, such as depression. That's what the doctor has made it clear, okay? These are clear symptoms. So I want people to be aware of that.
Okay. Can I also come in and okay, William, do you have anything to say, or should we go on? Yeah, I want to look at. I
think we've lost Elsie's voice. We've lost Elsie's voice. If we want to take the discussion further, I think we need to, for the benefit of our viewer, discuss how people experience mental health difficulty in Africa. I think Joanna, Dr. Larry might be able to help us, talk about what are the experiences of our people, experiencing mental health in Africa.
Okay, so Joanna. Thank you very much. Thank you very much. I want to add on to what Dr. Ajele said. I think he's really said a lot about the symptoms. But one thing that I want us to know is that all these symptoms does not happen to one person. Each person has a specific group of symptoms. And so that should be what we should have in mind. And then how it occurs. Usually, some people are prone to mental health problems. So, for instance, people may have family history of mental health. And when they go through stressful life situations, these symptoms are triggered. And so there is a need for us to manage our stresses very well, or get support when we have stressful life situations. Mental health in the Ghanaian context. You realize that the Ghanaian community is believed through practice, myself through practice, through experiences that I've had with people with mental health, and some literature even suggests that the Ghanaian is a very spiritual person or highly superstitious person. And so you have the usual Ghanaian having a very strong hope and belief in spiritual influences in whatever happens around us. You realize that these beliefs that we hold as Ghanaians drive our behavior and even our choices in life. And it has rippling effect on the interpretations we give to things around. So for instance, when in Ghana, we would have predominantly Christian religion with varied inclinations towards whatever their practices are. We have the traditionalists, we have the Islamic community, and based on these beliefs that we have as a people, you realize that we place a lot of emphasis on the external influences, that the external factors on whatever we go through. So for instance, if people are going through very successful situations, they may attribute it to God, blessings from God, good luck, and others. You may also find out that when people are going through very unfortunate incidents or very stressful situations, we may attribute them to witches, wizards. Sometimes we may think that these are curses from things that we have done or what our parents or our family members have done. Sometimes we may attribute it to bad luck. So you see that the ordinary Ghanaian would place emphasis on these external forces. We hardly believe that we go through this, mental health is biomedical. And so you realize that even in seeking treatment or in seeking interventions, we may fall on the beliefs that we have. What we may ask ourselves, what caused this situation? And so if we believe that these situations are coming from witches and wizards, or I'm in this situation, or my son, my daughter is in this situation because probably he is cursed, or there is bad luck on the part of my child, then we may, or even sometimes we may think that because my child is handsome, beautiful, because my child is successful, or even has a bright future, a neighbor or someone wants to destroy this child of mine, and it affects how we even seek interventions here. Like I've said there, and like like William said, mental health doesn't discriminate. So it expresses itself in symptoms, as he has said. But the interesting aspect, if you take the delusions for instance, especially delusions of grandiosity, you would have people behaving in ways that suggest that probably those around would think, especially the person is in a church or a spiritual church, a Pentecostal and Orthodox church, we may believe that this person has some spiritual giftings or some extraordinary spiritual powers. And so those around that person may interpret whatever the person is doing as such. That person may also believe that, yes, I have some supernatural powers. And so you realize that out there, a lot of people who have delusions of grandiosity probably would pose as pastors or spiritualists, because that is a strong belief that they have as far as their symptoms are concerned. And then sometimes if we are perceiving these symptoms as maybe a curse or juju from someone or a punishment, then we may resort to some of these spiritualists for help. So, for instance, people who seek for help from diviners or divine healers, people who go to traditional centers for herbs and all that, people who go to the shrine, people who go to spiritualists who may change them. Ghana Mental Health Authority did a very good thing some few years ago. They visited these spiritual centers and released people who were in chains. People had been in chains for several years because of we perceive that they are aggressive. As we try to calm them down, they are changed. And so these days things are better. But when you go to some of these centers, people are doing the same. Sometimes we believe that these people are witches because of the way they behave and the symptoms that they display. And so the dynamics here is quite tilted towards the spiritual and the belief systems that we have. And that shows or that determines how our symptoms are expressed, our symptoms are seen, and how we also seek for help elsewhere. I think that I'll end here. And
Doctor, well, I will throw this to. I've got a comment over here, and I think I will throw this to everyone. So Madam Linda is saying that the churches.
William,
do you hear me?
Take on the moderation for now in her absence.
Oh no.
Hello. Elsie.
Do you hear me? Do you hear me?
Yeah.
I can hear you, but it looks like Dr. Ajile can't hear you. I don't know why. Dr. Ajile, can you hear the rest of us?
Yes, I can hear everybody.
I can hear the rest of you, but I cannot hear Elsie.
I can also hear everybody. Oh no.
Go out and come in again. Sign out. Dr. Ajile, please sign out and come in again.
Okay, all right, I'll do that.
Okay.
Yeah.
So, Madam Linda is saying that the churches need to be regulated. They are causing more harm than good. You know, this is obviously is Madam Linda's view. What are people's view over here? Do we feel that the churches are not regulated? I mean, some of them are not regulated. Do we think that that is contributing in any way to the issues around mental health and mental illness and spirituality?
Yes, okay, so I will come in quickly again. I believe that it's not limited to Ghana, maybe across Africa, yes. Everybody who receives some giftings or who perceive that I have some level of giftings would want to set up a church. And these people, you would be surprised have followers. One time I was discussing something with a friend and I said that, look, this particular person is behaving like someone with a typical delusions of grandiosity. And this person has so much followers. If you are not careful, this person with this mental health symptom would lead all the others astray. Why are we seeing on our set pastors telling people to chew grass, for instance, to drink Dettol, for instance? So I believe that, yes, the churches really needs serious regulations. We should set modalities as to who sets up a church. we should look at the backgrounds of these people. Mental health has been relegated in the health system for so long a time. And I believe that if we are regulating, if we allow the mental health systems to work, we can make a lot more impact than we are doing now. So if we realize, as we are doing, we are educating people, and I'm sure people are quite surprised, and I'm sure people are looking around for people who are exhibiting some of the symptoms that Dr. Ajele mentioned, and have already tagged them in our minds. But if we are able to identify these people and help them, I think that it goes for all of us. Our systems will be more productive than it is now in Africa. And so let's continue with this education till our leaders and those who have to hear about it, because the mental health issues here are causing more harm than good, especially in the churches, as Linda has suggested. Thank you.
Madam, thank you. And Madam Tina Latifa Jones is saying that I think should not avoid generalizing, as not all churches are causing harm. Individuals need education so they can determine which churches are genuine. In addition, the churches should have an independent regulatory body. Thank you for your comments, Madam.
I think that is exactly what we are saying. That is exactly what we are saying, that if these churches are regulated, if we know the criteria for who can set up a church and who can lead a congregation, I think that it will help. There are some churches that are doing very well. I must say that there are reverend ministers who refer cases of mental health. When people are in their churches and they are exhibiting signs and symptoms of mental health, they quickly call and refer to us. And I think that these people or these religious leaders should be commended. So I agree with her. Not all churches are doing that, but we have others too who are causing more harm than good in society. Thank you.
Yeah, thank you for that. We will come back to William. William, so we've got Antonio over here who is saying that extreme religion and culture is very toxic. So obviously we are looking at the place of religion, the spirituality. So and then we are within this, we are looking at culture. Can you expand this a bit more?
Well, just to add a little bit to what Dr. Larry has said. Now there are several cases that I have seen myself. I've watched videos of things that are happening. There are prayer camps who purport to deliver people who have been diagnosed with mental health, or actually seem to have symptoms of mental ill health. Now, what these people, some of them tend to do, we're not here. The idea of this whole show, we're not here to say churches are bad, mosques are bad, this religion is bad. No, that's not the idea. About this whole show. The idea is to create awareness. So when you see symptoms, you seek support. Okay, so I want people to be clear about that. No, we're not damaging churches. We're not damaging churches, and that's not the idea here. Now, when it's prayer camps and other things that I've seen on video, actually it is concerning. I mean, some of them I've seen where one person purports to be a spiritualist, and they were pouring a whole huge bottle of oil, olive oil, into somebody's mouth, to drink a whole bottle of olive oil to cure symptoms of mental disorder.
Wow.
I've seen people where they spit into their faces, they spit into their mouth in an attempt to cure a mental disorder. So these are the practices that we're talking about, that we feel that it has to be regulated. Whichever country that these are happening, yes, the countries need to have a set regulatory body to monitor these practices, because what they do is that they are making things worse for people suffering from mental illness. They're making it harder for them.
Okay, William.
Yes.
Thank you for that. I've got a question. Yeah, I've got a question over here. So somebody's asking, do you believe mental issues can have spiritual origins? So do we think in terms of what causes it or what can lead to, all these, I mean, some of these disorders, do we think, there is an element of spiritual origins, if that makes sense? Or sometimes, yeah, okay. So this person wants to know if there are spiritual origins. I'm not exactly.
Well,
if we look at it from clinical point of view, I doubt if any practitioner would agree with you that there is a spiritual origin to a mental illness. We look at it from the point of view of a disease, okay, that needs intervention, that needs treatment. However, people's beliefs, cultural, religious belief can affect how they experience it or their own attribution, to the nature of mental health they have. But, majority of mental health disorder have, medical or genetic causes. People have genetic underlying reasons why they, manifest mental health problems. People may have brain injury during birth, which obviously has disorganized or distorted their brain anatomy, and the only way it manifests itself is in form of mental health symptoms that we have explained. People may have been exposed to, using, mind-altering, drugs, which again, could precipitate symptoms of mental health. People may have had some medical conditions, which again, can translate into mental health problem. And people actually can develop what we call secondary, psychosis as a result of maybe having diabetes, for example, as a result of having, stroke, as a result of having maybe hyperthyroidism and things like that. So there are underlying medical conditions, medical reasons. There are also environmental causes. I mean, we talked about stress, and stress can exist in different forms. How we experience stress in the United Kingdom is different from how people in Africa experience stress. Stress can be from family, dysfunctionality. Stress can be from, economic loss. Stress can be from, domestic violence, for example. Stress can be from lack of attainment in education, from, sudden change in, people's, life due to maybe accidents or bereavement, and so anything of that nature can make people develop all the symptoms that we've discussed and that we'll be talking about now. But in Africa, yes, because of the predominance of spiritual sort of belief and how it is being propagated in the media, people tend to associate mental health disorder to spiritual causes. And that's why the first port of call, when people are, exhibiting these early symptoms, is to go and take them to their pastors. And that may also be because perhaps they don't have any financial means to take them to a doctor, or perhaps that may be due to their own level of education or psychoeducation understanding of mental health and what perhaps mental health disorder means. And that can, sort of cause a lot of problem and delay in people getting treatment, appropriate treatment they need, either medical, psychological, or psychosocial. So that itself has a long-term damaging effect on people. So we cannot take spirituality or religion out of Africa.
No.
We know what's happening there. But for our own people to be able to have education about mental health problems and to understand that, if you're taking your mental health, problem, finding solution for your mental health problem in spiritual, camps, you're probably not going to get it. People are just going to get worse. And by the time they will present to doctors, it would have been too late. And then it becomes completely incurable. Whereas if you are able to take them to the appropriate services at the earliest opportunity, they have a better chance of recovery. And they have a better chance of outcome in terms of their life, in terms of their interpersonal functioning, in terms of their global functioning, education, family, and in so many other ways. So it's about, early detection, early intervention, and then obviously signposting and using the right care pathway for people who have mental health problems rather than going through the wrong route. And that's
absolutely.
Yes.
Okay. So
I quickly want to add on to what he just said. So sometimes it's very difficult letting the person with mental health problem or the family of this person believe that this is purely medical. And so usually what I personally do is that, well, this is your belief. I can't stop you from believing that. But would you let's try the biomedical or biopsychosocial model of treatment whilst you go on with your spiritual interventions as well. And so sometimes, as personally, I take time to explain the modalities of mental health problems to the family of my client. And then sometimes some of them believe, or some of them get insight into what actually they are going through. And sometimes others to contest. But eventually you get them to use both models as intervention methods for successful outcome. Thank you.
Thank you for that. And then we've got Mr. Paul Boateng, who is asking that if mental health is genetic, how then can it be avoided? And I want to link his question to Tina's question. So Tina is also asking that, saying that one of the ways to avoid or prevent it is by knowing one's genetic makeup. So so the question is saying that it's asking how, I mean, if it is genetic, then how do we avoid it? Because is it possible to, avoid it if it is genetic, basically? Yeah. And then, Tina has just thrown some lights on this over here. Protect yourself from unnecessary stress and trauma. And, just know your genetic makeup. So can we throw some further light on this, please?
I don't know if Joanna, you want to?
Sister Veronica.
Okay. So
Veronica,
talk about it.
I know I haven't said much in all this, and I'm just listening. I think my take on our view with mental health, especially with our community, is the fact that we need baseline understanding that mental health can affect any of us, and it can affect us the same way as physical health can affect us. I know in Africa we always have this thing that yes, mental health is linked to the spirituality. If there's something wrong with your mind, then you're either cursed or you're a witch or all that. But I want us to get to the point where we understand that mental health can affect any one of us, like physical health can affect us. And when it affects us, we need to get the understanding that we need to seek help. We need to seek help. I believe that before all of us got into the profession that we are now, maybe we had very little knowledge about how mental health affects us. But we've all come to the understanding that mental health actually affects us same way as somebody who suffer from probably a stroke or a diabetes or any physical illness. So my take on that is the fact that yes, now we understand that mental health can affect us. And the most worrying thing about mental health is the fact that it's something that is taking control of your mind that you can't even understand and explain. Okay, so then if you're around family members who you don't understand it in the first place, and you're around family members who also don't understand, they see you and they think that you are behaving weird. My take on this will be the fact that with what we're doing now is great, but then we're sharing the message one person at a time. That the doctor has really explained what it is like, the signs and the symptoms that we look out for. So then in our families, in our little communities, we're looking out, and when we see somebody showing those symptoms, let's reach out. We're giving the message out for people to be aware that mental health is real. And it's not that it's demonic, because all of them have got baseline where they started from. It all has an underlying issues where it came from. We need to understand that yes, it can attack any of us at any time, based on whatever we've gone through, based on traumatic issues that we've had in our growing up, based on environment where we've lived and all that. So making the word known out there that, look, guys, mental health is real. We can have issues with our mind, but when we have issues with our mind, there is help out there. Like the same way that I'll go to the doctor and say, I'm suffering from a headache, I've got a migraine, and I've got and stroke, and I've got heart disease and all that. It's the same way that we are suffering from our mind. Let's speak out. Let's encourage each other to speak out about how we're feeling. Ghanaian community and African community, we don't talk much, especially when it comes to mental health, because we've demonized it. And it's like, if I talk about it, then nobody will come to my family, nobody will marry from my family, or all these things. And because of that, we're stuck in that bubble. Now we are out and we're making it known that, look, guys, it is real. It can affect any of us, but there's help out there. Let's seek help. We should avoid churches and pastors. And as we've said, it's not all churches who are doing that. And we need to be clear about that. That churches, as Doctor has said, there are some churches, and Dr. Larry has said, churches are referring people now because they're getting more understanding about what is happening. It's not only when you pray. We need to deal with the underlying issues as well as the same as if we pray, because people's faith works for them in different ways. So as Dr. Larry has said, we cannot eliminate that. We should don't do anything with your belief, but at the same time, let's give people the understanding so that we work side by side with people out there. Get them to understand that mental health is real. Get them to understand that when you identify it early enough, something can be done about it, like Doctor has said. If we leave it too late, then it gets to the point where it's gone too late, and then treatment takes longer, or then it's very difficult. When we seek help out there, initially when we're feeling that we're feeling that, no, everything is not right in my mind, let's speak out. Find somebody that you can speak to. A lot of us have got friends, social workers, psychologists, and all that. Find someone that you can speak to about how you're feeling, and the person can guide you to the right place to seek help right at the beginning before it gets worse.
Can I just make
that is
okay? Let me quickly add. I want to quickly add on. I think that she briefly touched on the issue of stigma. Stigma is real in Africa.
Yes.
Stigma is very real. We see, because of the symptoms that they exhibit. I think when Dr. Adele started mentioning the symptoms, people started commenting that this is insightful and all that. The kind of, we don't understand the nature of symptoms that they exhibit. And because of that, we classify them or group them as people who are weird, or even people who are witches, and so should not be part of the usual or the normal people. And so we place them, and families, they come in a particular category. Let's take this. If you, mental health issues concern everybody. Each and every one of us have mental health issues, one way or the other. If you take the medical conditions, people may have brain tumor, but people may also have common headaches.
Yes.
In the same way, when you bring this to mental health, you may realize that sometimes we go through very stressful situations that you may be holding your phone and you'll be looking for it. That is a mental health challenge as well. So it's a matter of degree. So we should be very careful about categorizing these people, demonizing them, and then putting them in certain boxes. Let's all support. In Ghana, fortunately, the systems for intervention has improved drastically. Because of stigma, people were not seeking help. If you go to the psychiatric hospital, for instance, people would categorize you. So people were hiding their loved ones who have some of these symptoms. Now, mental health care can be sought in any general hospital with psychiatric units. Because of the stigma, now you go to any main hospital in Ghana, there is a psychiatric unit that you can freely walk in, just as you are walking into an eye clinic or a medical department or a gynecological department. So let's encourage people to walk in and seek help. Help is readily available.
Yes.
So let's encourage people to seek help.
Yes.
Thank you.
Can I just clarify a little bit more about the genetics? Because obviously it is something that people will be concerned about, and they will want to know. Because as we said, we are all vulnerable and at risk of developing mental health to some degree. But what increases every individual vulnerability is the genetic, loading. Okay. Now we're talking about psychosis today. Now, majority of psychotic disorders have strong genetic, connection and predispositions. So that is why the assessment of, the condition in clinic will require taking detailed family history.
Family history.
Okay. And why are we asking about family history? And it's because we want to know if there's any genetic loading. So it's sad to say, but we need to understand that so that we can have a way of protecting ourselves and seek help early enough. Now, majority of virtually all the psychotic disorders and diagnoses like schizophrenia are genetically linked. You would find somebody in the family. Sometimes it may skip generation. You understand? Yeah, particularly schizophrenia can skip generation. But you will find somebody who is what we call like fourth degree relative. Okay? And these have been shown by studies, different, scientific studies, evidence-based studies, that even between, twins, and between parents. So there's always, a genetic link, first degree genetic link between the expression of, mental illness like schizophrenia, bipolar disorder, okay, depression. And, it will run in families. Either the parents have experienced the same thing, unless they don't want to tell you, or not, although many people may not have been diagnosed formally. Many people may not have presented to the clinicians to have that formal diagnosis. As, in our African setting, our parents or the older people may not be able to tell the younger one experiencing mental health problem now to say, oh, I had this problem in my own time. But when you look into the family circle, it's either they have an uncle, it's either they have a child, a brother, or they have, an auntie who has had mental problems. Particularly in the UK, we have people, we are all migrants here. And many of my patients will tell me, oh, actually, my auntie in Jamaica, actually, is in the mental health hospital. She's never been well. I've never known her to be well. So it might have connection with their own, condition. And if people are aware of their genetic vulnerability early, then what do they need to do? They need to obviously, try to avoid stress, sleep very well. And if anybody close to them or they themselves have enough insight to see that they are beginning to experience the same symptoms that is experienced by their family members, then they need to present themselves quickly so that they can get treatment. Because, the longer the duration of untreated psychosis, the more damaging it is for people's, memory, for people's brain, for people's cognition, and for people's general personality and outcome of their mental health. So I think it's important for us to know. Now, genetics and hereditary is not the only cause of mental health. But I think it's more important for our people because we want to know, okay, if my father or my daughter, is got diagnosis of mental health problem, does that mean our children is going to have it? That's a worry for people. If my parent has been diagnosed with dementia, for example, what is my risk? People often ask me that question, and many times we send them for genetic testing. It may not be available in Africa to do genetic testing, but at least with the history, family history, we can advise them, on how to seek intervention and the care pathway for that. And even alcoholism. Alcohol addiction can be hereditary in some situations. In some families. It can be strongly hereditary. Dementia, is hereditary in some family situations. Schizophrenia, bipolar, hypomania, anxiety disorder. These are all, although today we're focusing on psychosis, but they have strong genetic, connection in many patients.
Okay, thank you for that, Dr. Julie. Can we briefly go on talk about mental illness and the criminal justice system? I mean, my question over here is that what role does mental illness play in the criminal justice system? Can somebody with a mental disorder or mental illness go to jail? I mean, basically, that's the question. So, yeah, William, you want to come on?
Right, okay. Apologies for this. I had an emergency, so I've just come back. You won't believe this. I think I may probably associate this with spirituality here. I had a little bit falling down the chimney. So here you go. So people might probably think that's spiritual thing. Anyway, right. Yes. Now, what we do as mental health practitioners is that in some cases, when we assess people who have mental health diagnoses, sometimes you would have, for example, somebody might have caused an offense, damaged property, or being violent to somebody, and then they get arrested by the police. So what the police do is that the police will then take them to custody block, and then they will interview the person. Now, whilst at the custody block, the police sometimes may see some signs of mental disorder. So they have liaison nurses within the custody blocks, and the nurses will then assess these people. So if they see symptoms of mental disorder, they will call for a referral. Now, the referral, that's where me and Dr. Agyileye come in here, plus Madame Veronica, who is also a nurse. So we will then assess the person. If the person is mentally capable, what we call mental capacity, if they have the mental capacity and they are alert and they can engage in the investigation process by the police, then that's right, they can go down the criminal justice route. Now, where there are clear symptoms of mental ill health, mental disorder, and then they're not able to engage in the investigative process, then they will be assessed under the Mental Health Act with a view to being transferred to, for example, a psychiatric ward and then being treated for their mental disorder. So that's where the interface is. So where somebody is mentally capable, yes, they'll go down the criminal justice route, not necessarily that they may have a mental disorder, because sometimes we have seen cases where some people said, yeah, I have a mental disorder. It's A and B that caused me to cause these crimes. But when you interview them, as a matter of fact, it may transpire that they don't have any form of mental disorder. They are mentally alert, they are mentally capable to make decisions. And then in that case, yes, they will face the full force of the law under the criminal justice route. So that's our take on it. I don't know if my other colleagues want to add a little bit to it.
Okay. Veronica, you go, and then I will.
Okay. Yes. As William has said, definitely. I am ward based, so after everything has been done in the police cells and the doctors have gone to assess them, we go into the prison and assess them. And once the person has got an underlying mental health illness, we bring them in. If the person hasn't got capacity, as William has said, obviously, then they will come in for an assessment period where at that time we're still monitoring to see whether there are underlying mental health issues. That doesn't mean that they just go scot-free with the crime that they have committed, but we're just trying to find out whether at the time they committed the crime, they were unwell at that time. So our care on the ward is the fact that we are assessing them over a period of time whilst they still have a court to appear when they have capacity to attend the court. So during that period, yes, what we do on the ward is spend time with them, do a lot of talking therapy. That's what we do. I know most general nurses stay with mental health nurses. All we do is to talk, but we talk. It's only when we talk that we can know what is really happening, and that is where most of the work is done on the ward. Whilst they are there, if the signs and the symptoms that they are showing becomes very pronounced, obviously we have to treat them with medication. So then we will start treating, because we have psychiatrists there. We have a whole team of carers there who will definitely start treating them with medication. We have our psychologists there who have psychological sessions with them, and at the same time we're looking at their social the circumstances as well. So when they come on the ward, it's a whole package of looking at their well-being and their recovery. If they end up having to go to court, and they can plea, and obviously the psychiatrist on the ward is writing a report to say that yes, when he's coming to court, we have assessed him over this period, and we realize that yes, they have an underlying mental health illness that needs to be treated, so they can go to prison. If they don't have any underlying, and some of them make them up, then they go back to prison. But if they have an underlying issues, then they come back to us, and then we continue with the treatment that we have. In the forensic setting, the shortest stay they can stay with us is up to 2 years. So within that 2 years, we're still treating the symptoms, and then at the same time, you will get to know whether the person genuinely has underlying mental health issues. Obviously, we're looking at history right from the beginning, like the doctor said. We're looking at histories from childhood. What really made that person do the things that he did? Examples of things that we've had people who've set fires to their homes. I've nursed people who physically killed their parents at home. There was one patient who killed stabbed both mom and dad at home in our local community here in Milton Keynes. Stabbed both mom and dad. Dad died, mom didn't die, but he turned around and told her that mom is a very strong cookie. He doesn't understand why she didn't die. But definitely for him being with us for that period, it was very obvious that this guy had mental health illness. He had mental health illness. Some of them have been in the system before, and then they've been discharged out, and then they re-offend again. So yes.
Okay, I think there is.
Wow.
Oh, sorry. Can I talk?
Yes, go on.
Okay, all right, that's
yes.
fine. Yes, there is people with mental health problem can actually, be taken into hospital, and also they can be in prison. Now, there are different types of approach to that. You find that a majority of people in prison, I'm talking about general prison now, have underlying mental health problem, and they have prison psychiatrists who treat them. Okay, so, and their crime may just be, completely, general crime, rape, grievous bodily harm, theft, and all those kind of things. Yet they have mental health problem. Now, a lot of people sometimes try to use their mental health as a way to negotiate themselves away from their crime. But the judges and the criminal, justice process has a way of separating the mad people from the sad people and from the bad people. Okay. So, and then they appropriately give you the justice that is required for that. Now, we have a category of people who are mentally disordered offenders. Okay. Now, these are people who have serious major mental health problem, and they've committed serious crime, like murder or serious rape, and they are dangerous, and they are likely to also commit those crimes again. Now, so what happens is, if those people, commit those crimes in the community, obviously it comes to the attention of the police. Now, because they are known before to have this underlying mental health problem, definitely they would come to the purview of me and Williams at the police custody. They will see them and assess them, and then we will be able to make a judgment and advise that these people have a mental health disorder of a nature and degree that requires admission and treatment in hospital. And as a result, they are, at risk of harm to self, at risk of harm to others, and for their own health, they need to be in hospital. Now, the police may now say, well, this person has committed a serious crime. How can you take them into hospital? Now, they need to go to the court. Now, what would happen is, in that situation, they will require, the psychiatrist to determine whether they actually have the capacity and fitness to the interview.
Yeah.
Or fitness to be interviewed or not fitness. If they are not fit to be interviewed, then they may first of all need to be treated for their mental disorder to get them well enough to now come back at a later date, to be interviewed for the crime they have committed. Now, once they are treated, then they can now be charged by the police for the crime they have committed, and that will take them before the judge. Now the judge will require a forensic psychiatric report to say, can you give me an idea of the mental health of this person, and is the mental health treatable or not? Now the report will now inform or advise the judge as to the disposal. Where are they going to go? Are they going to go to normal prison, or are they going to go to a secure hospital, whereby obviously we call them secure units, either medium secure, low secure, or high secure, depending on their risk and dangerousness. So that is the disposal. Now, mind you, when they are before the judge, at that point, of course, they have solicitors who would want to get them the best outcome. So the judge they would want to put a defense forward. For example, somebody who has been accused of murder may, because of their mental health disorder, get a lesser, judgment or punishment. So their murder charges may be dropped down to diminished responsibility, okay, or as the crime is because of insanity. And once the judge agrees that that is the reason why they committed that crime, because of their mental health, and they are likely to be more dangerous in the community if they are released, then they will send them to a mental health hospital. Then they become a mental health disordered, patient. And most likely, they will not be released, and Miss Veronica will be the one looking after them in conjunction with the psychiatrist. Now, if before the court, they deem that, yes, they have mental health problem and they can be treated, they can still go to prison, normal prison. And then, of course, they will have to see this prison psychiatrist. They would now obviously have access to, forensic psychiatrists who will prescribe specific medication for them. So unless their crime again changes, if they commit a more serious crime, then they can look at them again and say, perhaps maybe this person actually shouldn't really be in a prison setting, because their prison setting is a very stressful environment. So it may actually contribute to the worsening of their mental health. So obviously with the solicitor can say, okay, can you please have a review of this case? And then they can now reassess them. And then with the psychiatrist, forensic psychiatrist, they can recommend that this their mental health is likely to deteriorate in this setting. And then they can be presented back to the judge, and the judge can recommend that they're taken to a mental health hospital in a secure setting. And that is how it goes. So people with mental health can exist, both in the general, prison setting, and go to the normal criminal justice system and pay for the punishment in which the crime on which they've committed. And some of them obviously can be absorbed, because of their mental health, but they still have to be treated. And, that comes under a purview of a whole range of different things. And it also depends on the severity of the crime they've committed.
Wow. Thank you so much, Doctor. I want to go on to Madam Veronica. Madam Veronica, in terms of practice experience, in terms of, care and aftercare, we want you to just give us a taste of what you do, at work here.
Okay, all right. Definitely, like Doctor has said, after everything is done in the prison and all that, and they come to us, obviously they come in to ask for treatment. And as mental health nurses, we're treating them for the illness that they have. We're not treating them for the crime that they committed. I need to put that out there, because we're treating them for the illness, because they have a mental health illness. And I know that, I'm sure a lot of us have heard about mental health nurses should be non-judgmental in their approach. When we are non-judgmental, we're non-judgmental because we're not judging them based on what they've done. Because if we're judging them, say for instance, I'm a parent, and then this guy that I have to look after, or this guy that I have to nurse, is a rapist, and he's raped somebody who is my daughter's age. If I don't detach it from myself from judging him for what he's done, I will never be able to nurse him. So I'm judging him from, I'm nursing him from a non-judgmental point of view. I should have a good listening ear, because, and again, mental health nurses, we talk, but we need to be able to listen, because it's only when we're listening that obviously you can hear what the person, you have to be able to make yourself available that the person can talk to you. So we build a relationship with our patients when they come to us. We are allocated patients as a qualified staff. You'll be allocated a patient that you are a name nurse to. A name nurse meaning that right from the time that they come in to the time that they are discharged, you take care as a nurse of their treatment. So from the time that they've been assessed to the time that the care plan is put in place and we are implementing the care plan to discharge. So it's a whole from beginning to end. So right now, from the time they come in, we're looking at them getting discharged. So you're working through that system. So we're not judgmental. We have to have a good listening skills. Listening skills, we have to have good communication skills, because when you're talking to somebody, it's not only what you're saying, it's your whole body posture that is showing. So if I'm talking to my patient, I'm having a one-to-one with my patient, and I'm standing over them, it shows that I'm showing authority over that patient. That person wouldn't want to talk to me. So I need to sit down and be calm and be able to let the person, reassure them that, look, I'm here to help. That is my work. I'm not judging you based on what you've done. I'm looking at what made you get to where you are to do what you did. So what happened? And we're treating that. Obviously, they'll be diagnosed with whatever symptoms of psychosis they are showing at the time. And that is what we're treating. And that is what we're talking about. So gradually, in terms of them having to be on medication, we're monitoring the medication, and we're monitoring side effects of the medication as well, because some of our antipsychotic drugs have got side effects. But thank God, over the past 10 years or so, most of them have changed that they have very less side effects. So at least, but we're still monitoring, because every antipsychotic affects everybody differently. Yeah, so that is what we do as a nurse. We attend their meetings, we write report about their presentation on a daily basis. And as much as we have other team, other disciplinary working with us, the nurses, because we are there 24/7, we get to know our patients more. So then when you go to meetings and you're writing report about them, it's what you see on a day-to-day basis that you report. And that is what helps other disciplines. Psychologists are there who are having psychological sessions with them to find out exactly what happened. And I will not stop saying that as much as mental health is an issue, there's always an underlying issue about it. And we always need to find where it is coming from. It doesn't just happen, but there's always an underlying issue. So our work from the beginning to the end is the fact that we're working you through. They might come in and they don't have an insight because of the way the disorder has affected their mind so much. But with the help of medication, with the help of therapy, and with the help of other discipline coming in, they get to the point that when the medication starts working, they start having insights into what has happened, to the extent that the one that I gave the example about who killed the guy who stabbed both parents, and that died. Mom survived, but that didn't make it. They get to the point that when they have insight, then they start having remorse about what they've done. Okay, to the extent that when it gets to the point where the anniversary of the offense happened, again, we have to keep an eye, because once you know that, oh God, I killed my dad, but even though I killed him when I wasn't well, I feel bad because I took his life. And then they start showing remorse to the point that some of them, at that time of the anniversary, we have to watch their mental state, because they get to the point where they get into depression and we have to watch it. Or sometimes we physically have to have a one-on-one observation with them just to get them to go through that traumatic period. Yeah, so yes, that's what we do. And then after, well, when they get better and they're going out, as we're looking at where they're going, they're in terms of the care package when they're going out, we're not just going to discharge them out there into the community, because when you discharge them without a support, they are bound to reoffend again. Even those who go out with support, they still reoffend at some point. So we make sure that we have a care pathway package, a discovery package, and a discharge package with them that, for instance, when they go out the first few 3 months or so, then they have a community CPN who will go and be checking on them. Depending on what medication they are, if they are on depot and they need to be taking their depots. Depots are some antipsychotic medication that they don't have to take orally every day. So some of them, especially those who are non-compliant with medication, then we suggest that before they get discharged, then they are put on depot medication where they take it either every 2 weeks or every month. That maintains their mental health. Yeah, so then we'll make sure that before they go out, all those things are set up in the community before they go. Again, in terms of the forensic area where I work, some of our patients, because of the fact that they have committed very serious crimes, end up in restriction sessions. Like a 3741 is somebody who's actually committed serious crime to the extent that it's not only the doctors who can discharge them, but then they are being looked after from the home office as well. So they are restricted in terms of their movement around. So everything that we're doing, like when they come in, they don't have access to go out for the first few months, where they can go out for walks in the community and all that. But everything that we're doing in terms of in terms of the progress of their treatment, we have to ask permission from the home office. That is those who are restricted. Yeah. So even in their discharge package, we have to prove to the home office that this guy has done psychology, he's taken his medication, he's compliant with every OT activity that he's doing, and all that. He's compliant with the team that are looking after him. So we believe that is the time for him to give him access where he can go out. Because yes, we admit them, but our focus is not to admit them to keep them forever. We admit them to care for them and make sure that they can go back into community and live in society.
Integration.
Again. Yes, integration back into the community again. So that's what we do. We will plan their care program approach, which is part of their care plans, that we will plan a care program approach for them, where we're discussing everything that is happening on a 3-monthly basis. We have those meetings, 3 monthly to 6 monthly basis. We have those meetings just to see progress that they are making. And the more progress they make, the more freedom they have in terms of them going back. So yes, some of them will ask, oh, so this person has committed this serious crime and you still allow them to walk around. Yes, if the person committed the crime when they were unwell, you can't hold them. It was because they were genuinely unwell, and you need to be able to gradually integrate them back into community and back into society. Yeah.
Wow. Thank you, Madam Veronica. We've got Madam Linda here, who is saying that, Veronica, you've got a wealth of experience. Please consider going into Ghana from time to time to volunteer in assisting to supporting the nurses back then. So thank you. So you need to.
Yeah.
I agree.
I understand that. And yesterday I was telling my kids that I've met Dr. Larry now, and it's a good thing. For the past, I said that I retired 3 years ago, and I've been going home frequently. And my heart cry is the fact that when you go home, even in our own families, you can see things and you can identify things. For the fact that people don't have understanding of what is happening, that is why they're not seeking the help. And I happened to meet two people in Ghana who one of them was actually, this person was a pastor, and the pastor's wife was going through the pastor's wife wasn't well. She wasn't well, which at the time when I met them, she hasn't been well for the past 4 years, but it was only 2 years down the line that they decided to seek for help. So I just happened to visit a friend in Takoradi, and then she said, oh, I've got my pastor friend whose wife is not well. Can you speak to them about it? And honestly speaking, like that person is saying right now, after speaking to the pastor, what he said was that, Veronica, you have given me wealth of knowledge and understanding, because even though I've been taking my wife to the hospital for the past 2 years, no doctor has even explained exactly. Obviously, she had a traumatic period. This lady has had so many types of miscarriages, up to about 7 miscarriages that she's had. And having 7 miscarriages is bad enough to really tip you over. So obviously she tipped into depression, and the depression wasn't treated, and it tipped into psychosis. She was having full-blown psychosis where she was hearing voices and all that. And the husband who was with her, they were quite young couple. They haven't had children yet. Obviously they've lost 7 kids due to miscarriage. And the fact that the man was there and he didn't know what was happening to his wife, he didn't understand it, and even though he was the carer, he didn't really know what to do. I spent about 3 hours just talking to this man, looking through the medication that she was. She was on the right medication. She was on fluoxetine at the time, and she was on olanzapine at the time that she was taking, which was right. She was on the right treatment in terms of medication. But in terms of therapy, I realized that for them, it was missing out, because even to sit down, I sat with the lady and I held on to her hand, and I was talking to her, and the husband said, nobody has ever, even when we go to the clinics and we go to the hospital, all they do is to write the medication for us. Nobody has really come close to hold my wife's hand, because everybody is afraid of her. And we are afraid because we don't understand what is happening to her. We are afraid because we don't know what to do and how to do it. So my heart cry for us and for us on this platform and for everyone who is listening to us is that once we have come and we've got the understanding of what we're doing, let's take it back. I am really all for it to go back home and then share the little knowledge that I have. If you can help one person at a time, I believe we should all do. Yeah. So Dr. Larry, I'm coming after you when I come to Ghana.
Great. Thank you. I quickly want to say something. I don't know where that person sort of, but I must assure you that we are emphasizing on the biological, psychological, and social model. Mm-hmm. And so for me, and I know some people do, we take our time, give the person insight, because once the person has insight, the person would cooperate in the intervention process.
Yes.
And the social aspect is that we empower the family members to give them the social support that they need to be able to make it. So I think that things are changing though. So maybe when you come, you add that support and then we roll it out. Thank you.
Yeah. So thank you. I totally agree with. Yeah, I totally agree with Dr. Larry Efutu. Obviously, we've got some really some brilliant people also in Ghana, and what we will be doing is going there to support, going there to add to the good work already going on there. Yeah. So thank you. And then we've got Madam Tina Latifa Jones, who's saying that I totally agree. Auntie Veronica, we need new communities both here in the UK and in Ghana. Yes, that is what Madam Tina is also saying. Yeah, so thank you. We are drawing the discussion to a close, and we will be looking at intervention, the type of support out there. William, are you happy to go into this for us, please? Intervention, support.
Right. Okay. So now, before we start anything, I just want everybody to just pause for a moment and then just think a little bit about yourself and ask yourself, how do you feel in yourself? Yeah, how do you feel? How's your mood like? How's your stress level like? I tend to call something a cylinder, a stress cylinder. Sometimes it's low, it's middle, and sometimes it tips to the brim. So how's your stress cylinder like? Is it full? Is it at the very bottom or at the very top? Yeah, I wanted everybody to just imagine that. Yeah, so now we have to look after ourselves. Everyone has to look after their own mental health, similar to our physical health. Well, we haven't done so much as not just as people from our community, but this is life in general. We tend not to prioritize our mental health so much. We're not looking after ourselves too well when it comes to mental health. The stigma that comes with it puts people off. And in certain societies, when people hear about mental health, they don't want that to even be associated with their status. So they'll rather, if a member of their family has got mental health problems, they'll rather ostracize the person. They'll cast the person away. Yeah, and we've seen that in our communities. They don't want that person at all to be closer to them. Now, we don't want that. So we need to look after each other. We need to look after ourselves and look after the people that are out there. our neighbors, our friends, our relatives. Yes, we need to support them. Now, the other day I said that now, if you look at what COVID has done to us, COVID has actually worsened the situation for us. In the UK here, we've got one in 4 people that experience mental health almost every year. And as I speak, over 60%, I was listening to a report last week, over 60% of people are experiencing a form of mental health. And that means that it's that crucial that we look after ourselves. So things like our eating, are we eating healthy? Are we having a balanced diet? Yes, are we going out there? Are we exercising? Yeah, we need to do a form of any form of activity to activate the good chemicals in our brain. Things like endorphins and serotonin. Yes, we need to activate these good chemicals to raise our mental well-being. In terms of work, I think people need to have a good routine for the day, especially those who are working from home these days because of the COVID. So people need to have a structure for the day. And I think that helps so much. Yes, if you wake up in the morning, some people might do exercise. They may go and do some walkabout. They may do some running. They may even want to do some exercise at home. Yeah, they've got some good facilities on YouTube. You can Google YouTube, check on some interesting exercises on these places, and try and do them at home, even if you can't go outside. Yeah, let's do a form of exercise. It really helps. It gets the mind engaged. Let's look after our well-being, so it helps. Now, obviously, if you are feeling low in mood and you are experiencing a form of anxiety, get talking. Yeah, don't keep it to yourself. Get talking. Talk to people. Talk to your friends. Talk to your family. Yes, they got various platforms that you can talk. These days we got video communications now on WhatsApp, on Microsoft Teams, on Skype. Get talking. It really helps. Don't be isolated. Don't be on your own. If you have a church community, if you have a faith group, yes, get engaged with them. It helps. The other aspect I also want to talk about is that we need to look after each other. We need to look out for people in our community.
Yeah.
We need to be doing that.
I think those are...
Now, if you look at the helpline...
advice.
Hello. If you look at the helpline, yes, you got anxiety. If you got anxiety, ring the numbers that are coming on the line. But don't keep it to yourself. Your first port of call will be your GP. Yes, I know there's a stigma out there, but get support from your GP. Now, when your GP, if you disclose that to your GP will obviously assess your mental health and direct you. If you need to be directed to community mental health team, your GP will do that assessment and then signpost you to the local community mental health team. Now, the local community mental health team consists of a group of professionals. So they got nurses in there, they got doctors around. Yeah, they got nurses who can actually visit you at home and carry out mental health assessment and give you the necessary support.
Yeah.
If it gets to crisis point, then yes, they've got what they call home treatment team, which is also within the UK here. And your doctors can signpost you to them, and they also can support you with support to help your mental health. It's also a team made up of doctors, it's made up of nurses, and they are linked with social workers as well, who can assess your need and provide the necessary support that you need. And then obviously, they deal with crisis point. You don't want to wait till things get into crisis point before myself and Dr. Ajileye come in to do a mental health act assessment with a view to looking at maybe detention in a mental health hospital. So you don't want to wait to that very point. So like I always say, try and nip it in the bud. Yes, get support as quickly as you can. So that's what I can say, Elsie.
All right then. Thank you, William. Madam Edna Anin is just asking that she's saying that work is working long shift, long hours or long shift, same as physical exercise. Do you still need to exercise if you are always working?
I believe when you're working, your brain is in the work mode. When you're exercising, it's different. So we can use work as exercise. If you're exercising, it's something that you're doing for yourself. So you choose to find the time to do that because you know the benefit of the exercise. Say for instance, if somebody wants to lose weight or somebody just wants to be fit, working at work will not make you fit. Working at work, obviously some of them walk up and down a lot, but psychologically it's not something that you're doing intentionally. And I work, I do shift work and I work, but at the same time I make time to exercise because I know what exercise does to my brain, what it does to my heart, and what it does to my body as a whole. So I would differentiate work and exercise as two separate things. That's what I would say on that. Yeah, and I think unless somebody wants to say something on that before I say what I want to say again, that's different from the work.
Well, there's clear difference between the two. Exercise is different from work.
Yes. Okay. And I think I wanted to also add on what William has said in terms of help. We have laid the foundation that whether we like it or not, mental health is something that can affect any of us at any time. It's something that it happens like any physical health happens, that we can develop physical illness at any time. Women, as we're growing, we go into menopause, and menopause affects us in so many ways that we're finding how to deal and how to cope with it. It's the same way mental health can affect us. I just want to come from the point of view that we who have the understanding, we're sharing out the understanding and the knowledge out there. When we are around people and we can see that all is not well, let's also reach out, because sometimes when people are going through that, and especially with the stigma that we have as Africans and the fact that we don't like to talk, we will talk about all general things, but when it comes to talk about deep things, we shy away, or then we don't want people to know our business. If I tell somebody my business is going to go out there and everybody's going to know about me, so then we shy away from having to talk about the important things that matters to us. I would say from my experience over the years and for the people that have been around, it's not difficult for you to be able to identify that, oh, all is not well with my sister and all is not well with my brother. We have the opportunity when we have a relationship with somebody to be able to approach them and ask. If the person says, no, leave it, it's not your business, fair enough. But it depends on what relationship you have with that person for you to be able to talk to that person. And I'm saying that because as I sit here, not long ago, from November till now, I have physically been out there to somebody who is very close to me, who I realized that was suffering from mental illness, to the point that I had to say to the person that, look, if you don't seek help, my fear for you is that you can seek help early so that you can start treatment and then you will still be around at home and around your children. If you leave it too late to the point where William and doctor will come and have to assess you and remove you and take you into hospital, that is even more traumatic. So when we see it at the beginning, let's reach out to people. We shouldn't be afraid. Let's take up that cap of, I don't want to get into people's business. And sometimes it's good to get into people's business because you know and you can see that you're trying to talk to them about it. You're not forcing them to do anything that they don't want to do. For this person that I'm talking about, it took them about 4 5. The person went with a struggle for nearly 2 years before they came to realize. And I didn't stop talking about it. I said to her, look, you need to seek the help. You can't physically drag them, but you're being there. You're trying to understand them. You're being compassionate. You're being empathetic about how they're feeling. And every time you're talking to them, you're bringing them out. And then that gives that person the opportunity to tell you how they're feeling, to the point that I said to this person, look, you need to go and seek help. And that person is a Christian. I'm a Christian too. But when you see these things out there, sometimes we need to deal with the underlying issue, speak to them about it, get them to get help. Physically, to cut a long story short, yes, it got to the point where the person said, oh, Auntie Vero, yes, I want to come. And can you come with me? Would we be willing and to give our time to go out there, physically take this person to the GP for them to get the help? And as I speak now, honestly, 3 months down the line, I can see the difference in that person. The family can see the difference in that person. Even people around her can see the difference between that person. So please, let's reach out and help out there. Secondly, we should also, at the same time as we're helping the person who is going through the illness, let's also educate the family who are around them. Because with this person that I'm talking about, family members don't know what to do. Children don't know what to do. They were all confused. Everybody was stressed about it. But then I had to sit down and say that, look, before mom got here, you knew how she was when she was looking after you. So something has happened that has made her feel the way that she's feeling right now. We need to find out what it is. We need to educate ourselves. I need to go out, and I said to the children, look, these are resources that you can read about, things that you can see that is happening. Man, oh, mom is behaving weird and all that and all that. And the more we make them feel, because in the first place, they are not in control of what is happening in their mind. And the more the people around them makes them feel as if they are nothing. I think yesterday in our meeting, we spoke about people losing their self-esteem and all that. They're struggling with what is happening. They cannot explain it. So the people around them need to have the understanding that, look, this person was this, like this, but now they're here. There must be something happening. Can I call somebody to ask and see, look, this is happening to this person. What can I do? And once they have a bit of understanding of what to do and how to support the person, it works for all of them to understand that it's a journey that we have to go through, but we all need to be there to be able to support this person to seek the help that they have. Help is out there. And for our African community, please, 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 there is help out there. Let's take out the stigma. Let's take out this thing of, I don't want anybody to get into my business, because when we do that, we leave it till it's too late. But when we pick it up early and we talk about it, there is help out there. And let's treat mental illness as if it's a physical illness that we can go to the doctor to give me medication for my diabetes, to give me medication for my heart problem. Let's treat mental illness the same. And let's know that there's plenty of help out there. It's not only for the English people or for the Western people. It's for us as well. And it's at our benefit. So let's use it to our benefit, please. That's the little that I say.
Fine, let me quickly add on. I'll quickly add on. So sometimes with the help we are talking about, sometimes people ask for help, and when they see significant changes or significant improvements, they go sit back without continuing reviews. We want to emphasize the fact that continuous care is very important.
Yes.
So let's encourage family members around. Let's encourage our children, our family members to seek continuous care.
Yes.
I have already mentioned the fact that you can walk into any major hospital in Ghana where there is psychiatric units to seek help. Fortunately, our community psychiatric nurses are doing fantastic. Some of them follow up. If you are moving house or if you are moving neighborhood, you have to alert them so that continuous care would be given to you. So I believe that those of us who are listening should also help us in the education for us to be able to achieve what we have set out to do. Secondly, we all have social support systems around. Let's activate them. Sometimes we have them, but we don't activate them. Let's activate our social support system and let's use these systems for our benefits. And I'm sure that even if you begin having some signs and symptoms of these psychotic disorders we are talking about, your recovery would be better and faster than when you don't activate these systems. Thank you very much.
If I may just add my own, I think we're doing this program to obviously create a lot of awareness for our viewers, and by extension, we hope that message will go out there. I think people need to understand that not all mental health problem would need hospital admission.
No, not at all.
Okay, so there are a majority of those conditions that can be treated also at home, and if patients have understanding that this is a condition that is treatable, and they are given medication for it, as Sister Veronica has said, then they need to take the medication. Now, some of the people who would experience mental health problem because of their insight and how it affects them, they may need some adjustment because some of them, their self-confidence their their belief about themselves may have been, sort of challenged as a result of their mental health problems, and they will need psychologists. So, and they will need a period of therapy to be able to adjust to that and have a better rehabilitation of their whole person. Yes. So it is not just medication alone. No. And some patients need to be taken into hospital. Yeah. And it's not every time that patients who are experiencing mental disorder or psychosis would need to be forced or taken to hospital against their will. Sometimes, they can go into hospital voluntarily. They can go and get the treatment they need, and then they go back out in the community. And their care will also continue from there, because there are community, mental health outfit there that's there to support them and also monitor, their recovery and ensure that they stay well. I think the idea is for people to get the intervention at the earliest possible time, to get the treatment they need, and also to ensure that once they're out of treatment, out of the hospital or out in the community, they stay well. Yeah. Now, we need to understand that, mental health can affect everything we do. I mean, I'm sure that, you cannot put somebody who has a serious mental problem in charge of, a bank, or in charge of a country, because they are not capable of running things. So we can see how important it is to look after our mental health and using approaches like has been described by William, basically having regular mental hygiene, work is very important. If you know you have a genetic connection or vulnerability, make sure that obviously you seek intervention as quickly as possible. And I'm sure that, doctors in Ghana or in Africa, anywhere, and particularly in the United Kingdom, will be happy to make referrals to the appropriate specialties where people can get the help they need. But if you don't go to them, then it can really easily become a crisis situation. Yeah. I mean, in Africa, if you suddenly run amok and run into the street and become naked, then, people can really, it can be very distressing for people. You don't have to let your mental health deteriorate to that level. In the United Kingdom, people can be picked up on the street by the police and then taken to a place of safety, or picked up and taken to a police station. It doesn't have to be like that, because all those kind of experiences can be traumatic for people. Because when they get well and they reflect on what happened, it can be destructive to their to their self-esteem and confidence. And we don't want people who experience mental health problems to be as bad as that. The fact is that when you are ill and you have mental health symptoms, and people around you notice there's a change of behavior, or you're exhibiting all those symptoms that I described earlier, the thing you need to do is to seek the attention of the doctor. Now, the treatment we give to people can reverse those symptoms. So you can actually have complete rest. So just like if you have headache, or just like if you have, for example, let's say hernia, we can remove those symptoms and then you'll be fine. So it doesn't mean that you won't have scar there. There will be scarring of your body. So also there will be scarring of your brain. But the fact is that we can actually reverse those symptoms quite quickly for you. Therefore, it will stop you from having disorganization of your personality. It can protect the family. It can protect, your the people who are close to you as well. And also family involvement, in supporting people with mental health issues is very important. People need support. People cannot be isolated, because if they're isolated, they're likely to disengage. They're likely not, not to get well, and that can lead to depression, which is another type of mental health disorder on its own. So when we identify people with mental health problems, it is important that we ensure that they are close to people around. They have people around them to support them, to talk to them, to also assess, how they're progressing in their mental health. And if they're relapsing, people can easily, identify the early relapse symptoms and ensure that obviously they present them back to the hospital. They may need a review of their medication or treatment intervention. They may need just a dose to be increased, or maybe their old treatment plan can be changed from either maybe oral medication, back to depot. And then, of course, some depots it's just once every month that you have to take it.
Yeah.
Some depots we now have some depots that you can take every 3 months.
Wow.
So, and you can just take 4 injections in a year. And that is it. Your mental health is stable. You can continue to function. You can go to work. If you are bipolar, for example, if you're an accountant and you're bipolar, you can stay at work. So your productivity is better. So if you don't access those help, then of course it's going to affect your global productivity. It can affect your family life. It can affect your education. It can affect your relationship. So we can see that not only has it got any, medical or physical side effect, that could be, social complication as well. So we cannot emphasize this enough. You don't have to allow mental health to get to crisis situation before you get the help we need. Family should be very observant of changes in behavior or experiences that is unusual and abnormal, and they should not, sort of downplay it, and they should present these people early enough so that they can have treatment and they can stay well, and everybody will be happy. I think this is the message we are trying to send to our people.
Yes.
Thank you.
Wow, thank you so much. All too soon. Unfortunately, we've come to a close. We are running out of time. And I know we could go on and on and on. It's such an important and interesting subject. Hopefully in the near future, we would come back again to discuss into details, obviously looking at the other aspects of mental disorders. And again, thank you, Dr. Larry Efutu, from Ghana's perspective. And then again, informing, making people aware out there that there are so much support in Ghana. So if you are in Ghana, please know that there is a lot of support in Ghana. And we So finally, as we always do, we'll give our final word before the show. So just just a few seconds in terms of what your final word to the viewers on this show as they watch us. What are your final words to our viewers? So we'll start with William, please.
Right, I had just muted my microphone. Right, okay. Yes, I just want to say a big thank you to every listener, every viewer. It's been very interactive from both sides. So let's continue to spread the message. Yes, support each other as much as we can. People are in dire need of support. People, because of the huge stigma around mental health, there is fear of being judged, and people, because there's huge taboo about mental health. People don't want to go and seek support. People don't want to be labeled as having a mental disorder. But we all have a role to play here. So let's support these people. If we've got family members who are in dire need of support, yes, let's get in touch with their GP. If you have people, your neighbors, support them as much as you can. Let's look after our own mental health well-being. Yes, it's really, really important, especially during this period where most of us are working from home. It's important that we look after ourselves. So that's why I would say, and I just want to say thank you to everyone and to our panelists as well. Take care.
Thank you, William. Can we move on to Dr. Larry Efutu, please? What's your final word to our viewers?
Great. So we all have people around us. Let's be observant to people's actions, inactions, the way they behave, their actions, their feelings. Let's be very observant so that if there is any change, we can be able to identify early and give them the needed support. Also, those of us who are taking care, who have family members who are going through, we should also basically home caregivers. They should also take very good care of themselves as they take care of their family members struggling with mental health. Thank you very much.
Thank you. And we will move on to Dr. Ajele, please.
Well, what I want to say is that you know, mental health problem is serious. It can be disabling. And honestly, from clinical point of view, there is no spiritual solution to it. There is a role for spiritual intervention, but it is not a cure. Mental health is not about chaining people down and subjecting them to severe, you know, sort of dehumanizing behavior, such as we see people do. They are not supposed to be second-class citizens. Anybody is at risk of mental health, you know, and it can range from children up to old age. Therefore, you know, we should not, you know, stigmatize our people experiencing mental health problem. We should see them as people who need our help and need our support, and we can all support them to get the help they need. And thank you all for listening. I hope that we have learned one or two things from our conversations today. Thank you.
Okay.
Thank you, Dr. Ajele. We would move on to Madam Veronica, please.
Yeah, thank you so much to our viewers and the panel. Whatever has been shared here has been very fruitful. I think what I will say is that mental health is real, it's out there. Let's share the word, let's spread the word, let's be observant, like we all said. And I'm sure each and every one of us, when we look back, we can find someone in our family who might be going through that. It starts with one person at a time. Let's spread the word. Let's spread the word. Let's not hide, and let's reach out so that our people will be confident enough to speak to us about it. And when they speak to us about it, let's direct them to the right place to seek for help, because there is help out there. Thank you very much.
Wow. So thank you so much, you know, for the knowledge, for the experience you've shared over here. You know, it has been so educative. It has been so informative. You know, the insights given is just, and the wealth of knowledge shared over here, you know. So yeah, so we are grateful to you and to, you know, the panel over here. We said, yeah, good job, fantastic job, and thank you. And to our viewers, you know, obviously, thank you so much for your contributions and for your questions. For those that we could not answer your questions, we would go back on there and, you know, look at the questions and then make an attempt to address those questions, because we had limited time on the show. So yes, from all of us over here, we say thank you for watching and thank you for the contributions, and then we will see you again another time. Bye.
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 Bye. Bye.
Bye. Bye.